Good morning, it's October 28th. It is now 10:02, and I'll call the meeting to order. Eldon Callan?
Here.
Ed Hawkins?
Here.
Tom Bloom here. At this time, I ask you rise for a moment of silent meditation and then a pledge to the flag. Thank you. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Yeah. And we could pass this tape on to the city of Morgantown if they need to understand how meetings are run. Consents and approval?
Okay. We have 19 exonerations, $4,236.69, an exoneration and correction for Suncoast Village LLC. Fiduciary orders for October 28th, approval or disapproval of the interim report on the Konchesky estate. I believe you've gotten a copy of that in advance.
Right.
Third quarter report from Cynthia Stafford. Vouchers, General County Fund, $68,515.67. General County Purchasing Card, $6,054.07. Coal Severance Fund, $44,221.10. Camp Muffley, $3,503.45. Camp Muffley Purchasing Card, $271.88. Chestnut Ridge Park, $998.31. Chestnut Ridge Purchasing Card, $735.45. Mason-Dixon Park, $57.42. Mason-Dixon Purchasing Card, $32.20. Assessor's Valuation Fund, $55.69. Home Confinement, $7,827.29. 911 Purchasing Card, $10,583.31. 911 Cash, $2,852.54, for a total of $144,708.38.
And how would the commission like?
Second.
It's been properly moved in second. All those in favor say aye. Aye. It passes. We have introduction of new employee.
On the Konchesky estate, is
Oh.
that approved or disapproved? Was that included in the motion?
Was anyone here to object to it? Anyone here on the Konchesky estate? It was included in the motion.
It was included in the motion. Yeah, that's what I assumed. Okay. Introduction of new employee.
Yeah. Slipped my mind.
Yeah.
Thank you.
I'll be brief. Got a full house.
Really?
I'll do you, sir, for about 10 minutes.
Yeah, that's true.
Yeah.
We have one transfer
Thank you.
and then one is taking her place.
Okay.
We've got a transfer, Monica Johnson from Process Transport. She'll be going to our full-time reception. That'll be effective November 1st. Probation period of 90 days. Her salary position will be $2,201.57 per month. Taking her place will be Aaron Lawson. Aaron was with us before, left. I guess he couldn't stand it, so he came back.
He missed your
Torture, yeah, he missed the torture.
So he'll be back effective November 1st, full benefits as a process transport.
Move for approval.
Second.
It's properly moved in second. All those in favor say aye.
Aye.
Passes. Welcome and welcome again.
Welcome aboard.
Thank you.
Thank you very much. And you don't have to stay if you don't want to. Okay, at this time we will have comments from the public. At this time, anyone who would like to stand, speak on any issue, please rise, state your name and your address. And you have plenty of time to speak. Is there anyone who would like to speak? Seeing none? Okay. The public is closed. Okay, at this time we have Jesse Kaufman with a number of people to talk with us about the Monongalia County Community Health Needs Assessment.
Hi, how are you?
You can come up here, you can do whatever you want.
Okay, fantastic. I'm Lillian Smith, and
Okay.
I'm going to, let's see, I guess that'd be great. And I'll just pass out my cards too. I'm with the School of Public Health,
Thank you.
West Virginia University.
Thank you.
And we are here because we have gotten, we're working in partnership with WVU hospitals, with Ruby and with Chestnut Ridge. to actually do their community health needs assessment. And the community health needs assessment for a nonprofit hospital is actually a requirement by the IRS. And it requires that they do an assessment, that they work with health, public health, that they focus also on vulnerable populations, and that they get community input to actually decide what priorities need to be worked on for their community. The reason this is really important is that, and this is just recently, has this become, have we gotten some clarity on exactly how these things should be and how they should look, is because at those priorities, there comes an implementation plan. And the implementation plan has to say how the hospital is going to work on those priorities, and it's not access to care so much, okay? It could be community health improvement things like gardens, community gardens. It could be walkability. It could be structures in the community that are posing a public health issue. It could be all types of things. It could also be economic development. So it is really a comprehensive assessment. It's an opportunity to have a comprehensive assessment. They have to pay for it, and that's a write-off for them. The neat thing with this is that they have to do these things to be a nonprofit hospital. They have to do them every 3 years now, and they have to evaluate how they're doing on getting these the implementation plan every year, and have to report that on their 990 for their nonprofit status. So with the School of Public Health, the hospital really sees it as an opportunity to have much more impact in the community, and with that though, it really calls for a lot more collaboration, a comprehensive plan, really working together. And so the reason I'm here with you is that we're getting ready to get started, and we really need your help. We are partnering with the health department. Dr. Smith is one of the co-chairs of the committee that we'll be working with. Dr. Rhodes is a pediatrician with the hospital. He's the other co-chair. We'll be building a leadership team. And if you look at this, what I'm showing you is that we'll actually be doing a process where we'll organize. We want to work with existing groups who are also doing assessment and planning that deals with public health and other issues. And then we'll actually look at different assessments that have already been done. We don't want to assess when other people have already assessed. So we want to pull that information together. And so that would be the health department's assessment, the United Way's assessment, the county assessment, city, all these things that are being used to build into strategic plans. And also gathering those plans so we can see where we have overlap. And then this will be a very community-driven process where we'll get input from the community on what they think their priorities need to be. And that's also based on data that we'll be pulling together as well. So we will be actually putting together a profile of what's going on within the community, and that will include not only the health issues, but also the assets that we have, so we can see how we can build on those assets and align together. Okay? And then we actually get to the plan. So the implementation plan, the improvement plan is where we actually want to get so that we can all be working more together and using the few resources we have to improve the health of our county. Okay? And why I need you is that, of course, you're the county commission. We need your participation. We need your leadership and guidance. We would appreciate access to any former plans or assessments that have been done so we can see where we are. And again, we don't want to double assess. If you want us to include questions in this assessment as we're going forward, if you have information needs, we want to do that in collaboration together. And we're happy to do that. Again, folks sometimes are been over-assessed and not enough done with.
Like once it's evaluated, it just sits on the shelf.
Exactly.
Yeah. We had thing we did with Patty Hamilton. That was to the university too, right?
Walkability.
the walkability study.
Okay.
Extension.
We've done that. We've done a number of different things that
Fantastic.
we could work with you and share with you on. And I'm very active on the state level, and what we do on the state level, health departments and all. We were talking to the doctor here just last week about the issues within the state, and of course people don't want to realize that a lot of times, but people that, like in your position, people that work in government understand that county commission's authority is extremely limited, totally by the legislature. We can't go out and create all these wonderful things, but there are things that we can do, and this certainly is one.
Fantastic.
I certainly would be interested in participating because I believe I could bring a lot of the insight from the state level and the other 54 counties that I work with on a regular basis if anyone else is not interested in it.
I practiced dentistry for 40 years, so this is also something that is near and dear to my heart. Health is health, whether it's dental. Rather, I'd be happy to join Eldon with you. You mentioned the public gardens. I know that we did have one that was reviewed in Osage. That's where the walkability study was done. But there was a wonderful lady, and I would love to see an expansion of this. She was either from Brooke or Ohio County, who addressed the Farm Bureau. And she has done some amazing things in her county, making public gardens accessible in many places in the worst sections of the county. I'll get her name, but it would be a valuable resource for expansion of something like that.
Fantastic.
Is there a time limit or your plan? What is your time area and something like that?
So we will be doing the actual assessment.
We got new phones, so they're ringing all over the place.
Should I answer?
Yeah.
Somebody calling in to help out with the
Yeah, that's
assessment.
right.
That was it, right?
Someone up above calling to tell us something.
Another volunteer.
Another volunteer.
I didn't
like
see
it.
where it was coming from
Yeah.
at first. No, it's not mine.
So the time frame on this is that once we get started, this will take us about 9 months to
Okay.
actually do the assessment and the plan. And so we'll be working, be doing a lot of things, very well coordinated assessment and plan going together. And it's really important for us to be tapping into the people who are going to be involved in the planning piece and the assessment piece. So to actually say these are the priorities, because while we get data and all the data that comes out, we always hear about we're worst in this, we're second in that or something. We all get that, but why is that happening here in Mon County? And that's where we really need the community input, and we need the help and the input of the people that are doing the work here to really, so we can start really addressing these issues. Because there's not any just one thing that's gonna fix all this, right?
That's, I guess, bad on me. I just assumed that it would be an ongoing thing.
It is an ongoing thing.
Because you drew a circle here.
It is. No.
And organize, assess, prioritize, act, evaluate, organize, and it's a continuing
It is
thing.
a continual thing.
Oh, thank you. I just want to make sure I understood that right.
No. So, and excuse me, the priority, the timeline for the hospital, for them to meet their legislative mandate to have a community health needs assessment and an implementation plan in place, it'll be due by the end of the next state tax year, 2016 tax year. So for them, that starts their yearly cycle. The programs and the things that we will be doing in collaboration with what the hospital does will be ongoing and will be live, organic, things that'll be, there may be times when we realize, you know what, we wanted to work on vulnerable youth, and we were set up to work on healthy eating. So we need to get some other people to the table. We need to make sure we include other folks, and we look at some other new things that we're hearing about.
My one pet peeve that I'd like you to put in, which is after 36 years of being a guidance counselor, we seem to lack a comprehensive plan for the entire drug opiate situation.
I would agree.
Connection with the school system connecting with the adults who are watching the kids, and then I think the third part of it is where it affects us in the county is when we try and bring in businesses, and you need a skilled task force that can pass the drug test. So, I mean, that is something that, and I think years ago it was taboo. No one wanted to talk about it. It was just a few people. And I think that's the one thing I will say about, I'm real pleased that the president came to West Virginia, because now it's open. It's out in the open. We've all known it, but you know, it's been very difficult to deal with. But we don't have any comprehensive plan. In fact, we probably are doing the opposite in the schools, and because you're cutting back in areas, that's one of the areas you're cutting. So you're hoping or expecting someone else to pick it up. So that would be an area that would be one of my priority areas, that if we could work on something like that. And the only thing that worries me is, like you said, the plan doesn't have to be in effect for a year. I do hope that in the interim we could still work on something in the interim, because that needs to be dealt with now. And I just hope that's just my one thing. And I know you see it on your side, and we're seeing it on the streets too, which causes a lot of then the homeless situation, because they're addicted or have problems.
It's a trickle-down effect, and there's
Exactly.
so many different pieces and parts of the issue, and I agree. Having a comprehensive way to look at that is the only way we're going to start to make progress.
And I think by you being the catalyst of being overall, then we could get the city, the county, the other agencies that work together. I think what we have is little pockets doing great things, but no one doing together.
I would agree, and I think this will actually give us a great opportunity to really have all of our agencies, working kind of from a same operational plan type of thing. So we really look forward to that.
Well,
And helping to be the catalyst and the backbone, absolutely. That's where we see our role.
Someone's ripping our place apart.
Well, it's apparent that you have two people who be from dentistry and Charleston, and I think all three of us are very interested, and we're more than willing to help and give you any information that you need.
Fantastic. Thank you so much.
Well, thank you for coming. It's one of the positive things.
Just go to Diane, get her email, direct email.
Yeah.
And Ed will probably be more focused on some things, and I'll be more focused on other things, but together, we always meld together to make
It all
it work.
comes together.
Right.
Fantastic.
Thank
I
you.
really appreciate
Thank
your
you.
support and your leadership.
Well, we
Thank you.
appreciate your help in organizing all this.
Nice to have, I didn't know whether any of your other group wanted to speak or not.
Yeah.
Want to introduce them for the record?
Or they
So
can
this is, if you don't mind, we have I have a class in community
Yep.
assessment
Please
and
introduce
improvement. Everybody stand up, introduce yourselves, please.
So you're on TV, so your parents know that you're actually going to school.
Good morning, everybody.
Morning.
My name is Suna Halley. I'm a second-year MPA student here in the Health Policy Management and Leadership Department. I'm originally from Northern Virginia, and I love West Virginia. So it's been a great stay so far.
Thank you. Good.
My name is Parth Patel. I'm from Logan, West Virginia, and I'm also a HPML student here at WVU.
I'm Kayla Koss, and I'm from Waynesburg, Pennsylvania, and I'm also an MPH student, second year in the Health Policy Management Leadership Department.
I'm Zach Vance. I'm also a second year MPH student in Health Policy Management and Leadership, and I'm originally from Logan, West Virginia.
Hi, I'm Christy Belsick. I'm a second year MPH student in the Health Policy Management and Leadership track, and I live here in Morgantown. So.
I'm Mosum Mahar. I'm a second year HPML student from Jefferson County, West Virginia.
Very good. So we have the class that's working.
They wouldn't let you in there.
They wouldn't let you in.
Yeah, they wouldn't let you in.
But we also have other faculty that are working on this project, so this is going to be a
Please introduce them, too.
holistic.
Yeah, feel free.
Please go ahead.
I'm Christian Abilzo. I live down the street. I'm in the Department of Social and Behavioral Sciences at School of Public Health. Been around here for about 12 years now.
Now, you don't mean under the bridge, right?
I'm not taxed on
Sorry about that.
And you're from, oh, good, we have someone
Great.
else.
I'm Jessie Kaufman. I was
Oh.
originally speaking with Diane, coordinating us coming here today. I work in School of Public Health as well in the Health Research Center with Dr. Bilzo. I'm a program coordinator there, and I'm working with Dr. Smith to coordinate the Community Health Needs Assessment, so we'll be in touch.
That's great.
And this is my partner in crime. I think y'all know him.
Yes, he's a troublemaker.
Ted's coming there.
And Ted.
And Ted
And
Kratchek.
Ted.
Yeah.
The health department.
My name is Ted Krafchick. I work with the Monongalia County Health Department with Dr. Smith. I'm a public information officer.
Thank you.
Well, I'd like to see that we're all working together.
Glad
Yeah.
to meet all of you.
And from Waynesburg, that's where my wife's from, so I know all about. That's where I go every Thanksgiving. So I know all about Waynesburg, the big booming town.
Yeah, you couldn't say anything.
Yeah, I know. I better not now.
Punished big time.
That's right. Well, welcome, and anything time that we can, you know. You were born. Oh, I didn't know that either. Yeah. So, well, welcome, and we're really glad, and you have a nice cross section of people throughout the state. So, look forward to working with you.
Yeah.
Thank you so much.
Thank you, and your assignment is you can get up and leave, and you don't have to stay. So that's your reward for coming early. Thank you,
sirs. We appreciate it.
Thank you.
See? No, where's? Oh, this thing. Yeah, real quickly.
Yeah.
There we go. Good group.
Okay, Renetta. Grants.
Good morning.
Good morning.
We have a VOCA reimbursement request for September, $4,278.85. And I just need to read this into the record. Oh, here it's on.
Thank you. Sorry. I've got to get a
Thanks.
group pen before you.
We've got the West Virginia Humanities Council, you know, has sponsored a grant for Martin Bosson, who's doing the documentary Ageless Friends. He's the second drawdown for the a grant award is $6,692.98, and I already signed that because it requires a fiscal officer's signature. I just wanted to read that into the record. I don't know if you had any elaboration.
Move to approve the reimbursement.
Second.
Been properly moved in second. All those in favor say aye.
Aye.
And I have good news. I've talked with the CVB, and we're looking on June 18th. You know, that's when the premiere is going to be, and we're looking to do a gigantic premiere for the entire town of Morgantown and have it like a Hollywood type event with dinner and then afterwards, you know, cocktails. So we're trying to make it a really unique event for Morgantown. So June 18th will be the time, and we'll hear more about it. Thank you. Okay. Do we have any correspondence? Requests for file cabinets and chairs. I guess we're getting a bunch of these now.
Yeah, this is one that I have right now. Jean Friend is asking for 10 to 12 vertical file cabinets from the old office along with 3 leather chairs. Her new office does not have any filing system for anything other than the court files.
Since it was theirs, I guess.
Be out of their old office.
I thought this.
I really think these kind of requests, and I might be wrong,
Yeah.
but really think these kind of requests are administrative decisions that can be made by the facilities people. Isn't that the way we normally do things? If somebody wants a chair or something.
Well, what I request, because there was also several other requests and people were going down and tagging. You know,
Tagging?
literally tagging, you know, what they wanted and so on. We thought it would be better that we had a actual idea of
Formal
what,
request?
yeah, and that
More control.
control, and that way, and I don't see any problem with that.
Oh, okay.
Since it's theirs, that's why we did it that way, just so there wouldn't be
Oh, I
any.
understand.
Yeah.
I understand. So
I guess my only is
Yeah.
just, is it needed? Is there a determination of need?
Yeah.
Who is the assessment to say there's a determination of need other than a department head?
Right.
I mean, do you?
well, again, if they need it and they have space for it, and it's sitting down there,
Right.
somehow, that's my
Yeah.
opinion. I guess I
I'm
don't
of
know.
the same opinion. I just
Right.
would like a control rather than.
Well, that's what I'm
Yes.
saying. That's what I'm saying. I guess
I just
this
don't.
probably is a good idea to bring it here because of
Right.
the number of communication problems we're having down there. That you know.
I just think we got to make sure, you know,
I
first.
agree. I'm just not sure. I'm not sure what to
Yeah.
do. Whether I should make a motion or whether I should just.
How about it just comes before our attention, and unless we have a discussion, you know, we were agreeing that to allow the administration to make those decisions, unless we had a specific comment. I guess the only question we have, and I agree with Ed, is just to make sure that it's going to go down and actually be used.
Right. I think that maybe
Yeah.
that's why you should include Bobby Doyle in
Yeah.
this on a facilities type thing.
Right.
since-
If you and Bobby would, make the decision, but we're in agreement on that. But I think every issue has to come before us because they have been running down there and tagging, and I don't want to say taking, but we're making sure that.
Well, would you like for them to, and it's just discussion, would you like for them to okay, they address this and then come back next week and say, we sent X number of file cabinets and chairs
Sure.
to this office down there? Is
That's
that
a good
what you
idea.
want?
Yes.
Just like a weekly report? This
Yes.
is what we've moved out of here down there? Does
Yes.
that work?
Yes.
Does that satisfy you?
And allow the department heads there to make their request through this process.
Right,
Right.
yeah, yeah, but I'm just saying in terms of
Right.
oversight that you all are talking about, maybe a report would be sufficient, we
Yes.
wouldn't need a motion.
Right.
Yeah.
I agree.
Does that work?
Yeah, I do have a question though out of this. I've learned and talked to Mr. Bobby Doyle that I was under the assumption that everything was gone from the magistrate building. Everything was gone, and I guess there's still files and
There are more files than you can imagine. I
right.
took
And
the
how?
other day.
And I believe we need some sort of a plan of. I don't know. I don't know why I thought they all were taken.
We sent a letter last
Okay.
week. We talked about a letter going to the officials that moved as to when, before the end of the year, they want
That-
everything
okay.
removed from the
That's
building.
right.
And I haven't heard back from anyone.
Okay.
There's more in this building also.
There's more. Okay. But we need to look at that. Yeah.
This is a virtual catacomb downstairs, I discovered.
Okay.
Seriously, it is.
Oh yes.
So, okay on the file cabinet
Yes.
and the chairs?
Yes.
Yeah.
Okay on the file cabinets and the chairs?
Yeah. Are there any other correspondence? Okay. Unfinished business.
I have two things. A few weeks ago, you accepted the contract of Green River Group LLC in the amount of $171,048.88. This is for the replacement, repair of the stone wall at the corner of Chancery and Chestnut. It's on our property. It's just a contract for services that I'm asking the commission to approve and sign.
I move to approve the contract. It was an excellently written contract.
Thank you.
Diane wrote it, added that. Phil and I both looked at it and it looks good. I move we approve it and authorize the president to sign the contract.
Second.
Properly moved in second. All those in favor say aye.
Aye.
Okay, that passes. Any other unfinished?
And the other item that I have is the application for payment from the Sarah Corporation, the amount of $35,225. This is
For?
something we do. This is for the
Which
Justice
one's
Center
that? That's just a
contractor.
This is about the last payment except for the retention.
Right.
We're still holding about 800 and some thousand.
Okay. That's
And
what I was
then
curious.
once I talked with them yesterday, and after they get 90% of the punch list, I told them we may pay half of the retention and hold 400 until it's done.
Move for approval.
Second.
Been properly moved in second. All those in favor say aye.
Aye.
Passes. Okay, we're on the new business. Any new business for anyone? Okay, I like this. Reports from elected officials. Any reports from any elected officials? Mayor?
It's you.
Yeah. Okay. Seeing none, reports from county commissioners. Ed?
Did attend last Wednesday, was the Region 6 development, and they have some financial concerns. A new director is being hired on an interim basis. I believe one position is being eliminated. Also, they're proposing to raise the dues, which are paid by a formula. The dues, if they are raised, means that about 40% of all the due contribution is going to come from this county, despite the fact that it encompasses 6 other counties. I'll let you know what happens with that. Eldon and I both attended the MPO meeting. I'll let him report on that. But Friday, I went and watched 9 more children receive special needs bikes. Again, we're still in partnership, and if anybody knows anybody who has a child or knows of a child who does need a bike that can't ride a normal bike, please contact either Mike Lintz at Playworks or this county commission. As president of the Historical Society, I would like to commemorate, both Tom and I attended the unveiling, if you will, of the newly refurbished Coke sign on the side, also with Comunsi's. It's very great to see. I thought it was going to be gone. I suggested that you take a picture of it because you wouldn't see it again. So when something happens of historical import, I'm really thankful. Lastly, this is not good, but I read in the Charleston paper that to save money, the state of Iowa has decided to stop fixing roads and closing small roads and not replacing small bridges. What I hope, this is not a portent of things to come. There is a conference that's going to be held that we'll be attending next Tuesday, I believe, that will bring together those commissions from the North Central so that we can try and influence the legislators to concentrate their efforts on roads, jobs, and I believe also tourism should be thrown in there. But there's a lot of things that, that focus on what we really need and what matters. That's my report.
Thank you very much.
Tomorrow I'm going with a group of people from the Monongalia County Development Authority and Morgantown Area Partnership. We're going up there to Pittsburgh to review an incubator, set up some new things, new financing, new development ideas and programs with those two groups. So I'll be going there tomorrow. Ed mentioned the MPO. We had one of the interesting presentations was on the bus transit system. The big issue there really is that you have to take the question of service versus whether it pays for itself. And a lot of the rural routes are actually supplemented by the fares in from the county contribution. The track that we're on right now with the bus system is clearly one that we need to address. One of the things that I hope will come about is a recognition that the rural routes have an important part of it, but we need support from the federal level as well, and I'm be working on that with the National Association of Counties and taking that issue as part of the member of the Economic Development Group for NACO. So I'm going to be taking these bus issues that we talked about to them as well to see about money. We know that there's a budget cut was ordered by the governor. I think it was 4% or 4.5% or something like that. I did receive, we received a letter yesterday because a lot of senior centers throughout the state were getting, the rumor mill got crazy and was saying that a lot of senior centers were going to be closed because of this cut. Well, Commissioner Roswell from the Bureau of Senior Services made it clear that it's totally a rumor because the General Revenue Fund, which the governor cut to 4.5% from, does not directly affect any of the senior centers. That's not where the money comes from. The money comes, the only involvement seniors or our committee on area agency, the only thing that we have in the general fund is the stuff we do through the DHHR. We're trying to send matching funds. That would have an effect. Still, we've got to be very careful with our budget. Everyone's going to have to be very careful with their budget this year. It's just a reality that the coal is not going to be produced. And I was unable, I got so many different things going on. I'd like to attend that energy forum yesterday. I attended it last year. I didn't get around to it this year. But I got to agree with the president of the United Mine Workers, Cecil Roberts,
We have got to be creative in our use of coal. We should not just roll over. And I think people are wrong in just saying, oh, forget the coal. Coal has a valuable future. It just needs to be done in a responsible way. And I would encourage our legislatures to heed the comments of the other officials as well as the President of the United Mine Workers, Cecil Rhodes. Thank you. That's all I have.
Thank you, and I think that's a good time for one of the issues. There are two developments next week that I think that will affect probably the future of Monongalia County. The first one, as you're talking about, is they are having PEIA hearings on Monday, November 2nd at 6 o'clock, and people say, well, why is the county commission concerned about it? Because much of our population, it works at WVU or with the school system who uses PEIA. We also have PEI, is it retiree. I was fortunate, I guess, to go down to Charleston for 48 hours and sit into all the meetings, and here's what we've learned, and it's not to scare people, but I think people need to understand. Because there hasn't been any extra money put in by the government in the last 4 years, and medical costs have increased, the PEIA board by law has to make cuts. And this year they have recommended for a typical family plan, which is 90% of the people use this PEIA Plan A, it'll be a decrease of, or a cost of $5,500 extra per family. It's devastating. I think when people understand how large this is, it's, I believe, $1,000 deductible, $3,000 out of pocket, and then another $1,000 for the prescription. So this is an enormous. Here's the bad part. That isn't even the worst part of it. That's $120 million they have to save this year, like you were talking about funding. The fiscal year 16-17 is another $100 million, or another $90 million. No, another $100 million, and then the year after that's another $90 million. If there isn't any extra funds put into this system. So it's something that really will affect us and the future of Mon County and the rest of the state, because we're trying to bring in teachers, we're trying to bring employees, and I think it's something that we need to be very aware of. The worst part of it is for retirees. This is what we've learned, and people like myself, that the law right now reads that it's an 80-20. The state puts in 80%, the employee pays 20%. That is guaranteed by law right now for all active teachers. There is no coverage at all for retirees. So what this now states is that down the road, this could be like, you've seen other large coal companies where they've cut all the retirees, or added, make them pay 50-50 and 20-80. So it's something that we just need to be aware of, and I hope people show up for that meeting. The other meeting is a real opposite, positive. 2 years ago, the county commission, I think it was under Eldon's guidance, that we were able to come up with a committee that was looking at recreational needs. And we went to WVU and they did several surveys. We had 3 meetings in the community, and out of it came a master plan. Well, all I'm allowed to say, and the mayor's part of it too, is there is a meeting, public announcement, November 5th at 10:30 at Milan Park, that's going to change the structure of recreational needs in Monongalia County, and it's a great partnership. So this is coming through fruition. Yes, you want to?
It's not at 8 o'clock, is it?
No, you'll make it. It's 10:30. He can't make it at 8, but it's something real positive, and I think the county commissioners, all 3 of us, deserve a pat on the back. We don't usually get it, but actually we're coming through with a plan. So it's really exciting about that. Yeah, it's real good. And finally, I do want to, again, welcome Alex Everett. I guess I used the wrong name last time, who is working, and I apologize, so I will say Alex Everett again, who's now working with West TV. So is there any other?
Yeah, there's one thing I forgot to mention.
Go right ahead.
I should keep this and try to keep it in my head, but there's Interstate 79 access study as part of MPO meeting this afternoon at 4 o'clock at the airport. It is open to the public. I'm on that steering committee, but we'll be looking at the different issues of improving or advancing the various access points to Interstate 79.
Great.
So I forgot to mention that.
Well, good. A lot of things happening. I hope the public stays involved. Do I have a motion for adjournment?
Oh, so moved.
Second.
Been properly moved in second. All those in favor say aye.
Aye.
We're adjourned. It's 10:42.